You've probably been told to take calcium for your bones, fish oil for your heart, and keep the salt shaker far away once you're past 65. But what if that senior-friendly advice is quietly working against you, especially if your DNA says your body handles things differently? In 2025, new genetic testing reveals why some older adults feel energized while others following the exact same plan end up more tired, weaker, or foggier. So ask yourself, is your body fighting the very advice you've trusted for years? Let's look at why this happens so often in real life. Why seniors feel worse following good advice. Grandpa Joe has always been the type of man who tries to follow the rules. Every month, he budgets a substantial portion of his income for supplements. His kitchen shelves are lined with rows of bottles, vitamins for the heart, powders claiming to boost energy, capsules promising immunity. Each morning, he arranges them carefully before breakfast, determined not to miss a dose. And yet, by noon, he often drifts into an unintended nap in his recliner. His legs feel heavy on the short walk to the mailbox. And even in simple conversations, he sometimes loses his train of thought. At appointments, his doctor assures him he's doing just fine for his age. But Joe doesn't feel fine. He feels drained, older than his years, and increasingly frustrated that all this good advice hasn't translated into real energy or lasting health. Many of us know someone like Joe. In fact, some watching this may recognize parts of their own story in his. You follow the plan you're told will work, cut certain foods, add certain pills, lower this number, raise that one. The promise is that these steps will extend both your years and your vitality. But if that's true, why do so many in their 60s and 70s admit to constant fatigue, elusive memory, or muscles that feel weaker than they should? It feels contradictory. If you're following expert guidance, shouldn't you be reaping the benefits? Yet countless older adults are left echoing the same complaint that Joe voices, doing everything right, but feeling steadily worse. This gap between the advice and the results isn't because people like Joe lack discipline. It stems from where those recommendations came from in the first place. Most of the standard health rules for older adults were shaped decades ago, before personalized testing existed. They weren't designed with genetics in mind, but around population averages. That works for broad guidelines, but when it comes to how nutrients, medications, and supplements play out inside an individual body, averages miss critical differences. Consider the widespread push for low-fat diets, especially for seniors. The message for years was crystal clear: cut fat to protect your cardiovascular system. But physiology isn't that simple. Certain gene variants, as well as age-related changes in absorption, means some people actually need sufficient levels of healthy fats in order to utilize fat-soluble nutrients, such as vitamins A, D, E, and K. If fats are restricted too much, those vitamins slide right through without being absorbed, leaving behind weaker bones, greater fatigue, and reduced immune strength. For someone like Joe, swallowing extra capsules won't do much good if his body lacks the dietary fat required to take those nutrients in. The same principle applies to sodium. Most seniors are taught to avoid salt almost completely because of its link to blood pressure. Yet removing it too aggressively can create real consequences. For some older adults, especially those experiencing age-related shifts in kidney function or fluid balance, very low sodium has unintended effects. Lightheadedness, muscle weakness, and even falls can happen when electrolytes dip below what that individual body requires. Instead of universal rules, the reality is more complex. What protects one person's heart may make another person's daily functioning less stable. That's why clinicians now advise discussing sodium intake individually rather than assuming the lowest level is automatically the safest path. Supplements bring their own complications. Joe's faith in his cabinet of pills reflects a common belief that if diet falls short, supplements will fill the gap. The issue isn't that supplements never help, It's that not every form works the same inside every body. One clear example is folic acid. Many multivitamins include it as a core ingredient, but folic acid isn't active until it's converted into methyl folate. Research shows that variants in the MTHFR gene are common, and in those individuals, conversion is inefficient. As a result, folic acid may linger unused while the body remains starved of the active form it actually needs. Instead of energy and clarity, the outcome may be the same fatigue and frustration Joe feels. A simple switch, choosing the active form under a provider's guidance, often makes more difference than doubling or tripling the number of pills in the cabinet. What Joe is experiencing isn't rare. A substantial portion of older adults carry genetic or age-related differences that alter how they metabolize nutrients or respond to standard medications. When the majority faces these differences in one form or another, the idea of a one-size-fits-all senior plan begins to unravel. For many, what's passed down as safe and standard can quietly misalign with their biology over years or even decades. That doesn't mean a doctor's guidance is wrong. It means the framework itself was created in an era with less knowledge about genetic variation. Now picture the reality of living like this for decades. Avoiding fat because you were told to, limiting salt at every meal, taking handfuls of synthetic vitamins, all while your body was asking for something subtly different. Instead of moving closer to balance, you drift further from it. That doesn't create dramatic failures all at once, but slow erosion, stamina slipping, concentration fading, mood shifting, independence becoming harder to maintain. The result is frustration, not because of neglect, but because the effort was misdirected by advice written for the average, not the individual. This is the crucial shift in understanding. Health advice in the current age cannot remain detached from genetics. Affordable testing now shows us the specific pathways where bodies diverge from one another. To continue ignoring that and applying generalized instructions is akin to trying to repair a machine without consulting its manual, pressing buttons, and changing parts without ever reading how it's supposed to work. Joe's midday fatigue isn't laziness, and it isn't proof he failed his program. It's a signal that the program never fit him to begin with. So when you hear someone explain that they cut fat, eliminated salt, or invested in dozens of supplements, yet still feel perpetually exhausted, remember that wide variation is the norm, not the exception. The old idea of a universal senior diet doesn't hold up anymore. Age brings its own changes in absorption and metabolism, and genetics adds another layer. For countless people, this means that advice meant to preserve health can instead chip away at it, gently but persistently, over time. Joe's story illustrates more than an individual struggle. It reflects a generational pattern. Families watch loved ones pour energy and money into solutions that never resolve the tiredness. Communities see more elders wrestle with independence, not because of age itself, but because mismatched instructions keep them weaker than they need to be. What defines so many medicine cabinets, low-fat yogurts, and salt-free dinners isn't deliberate self-sabotage, but sincere effort misdirected by outdated thinking. The takeaway is simple. Precision matters more than ever. Generic rules applied to everyone cannot guarantee real vitality for anyone. The difference between fatigue and strength, fogginess and clarity often lies in matching support directly with what a body can or cannot process. And the hopeful part is that uncovering this information isn't a lifelong trial and error journey. It's available in a single, definitive resource, one that tells you from the outset where your system's strengths and vulnerabilities truly lie. The DNA roadmap you only need once. Imagine being handed a guide that shows the unique strengths and limitations coded into your biology. Not a broad manual written for millions of people, but a map specific to you, highlighting which pathways run smoothly and which tend to stall. For seniors faced with endless choices about diets, supplements, and medications, that kind of information is less novelty and more necessity. This is the promise of modern DNA-based testing, a reliable framework that helps explain why some health advice fails and what approaches are more likely to succeed for your body. There is an important distinction, though. Your genome, the sequence of DNA you inherited from your parents, does not change. A genomic or pharmacogenomic panel that looks at your baseline sequence is usually done once, and the results remain valid for life. That stability is what makes it so valuable for long-term planning. By contrast, methylation and other epigenetic patterns are influenced by age, diet, stress, and environment. They can shift over time, providing useful insights about lifestyle and aging, but they are not fixed in place. Many people confuse the two, so it helps to know exactly what type of testing is being described. Genomic testing is generally one-time. Epigenetic testing may be repeated if a clinician wants to track how your patterns evolve. The lasting value of a one-time genomic test is especially relevant to seniors because it often clarifies how the body absorbs nutrients and processes medications. One well-established field, pharmacogenomics, reveals how different variants affect the speed at which your liver clears drugs or your gut absorbs certain compounds. That knowledge can highlight whether a standard prescription dose will be therapeutic, ineffective, or potentially harmful. Clinical studies have already shown that when doctors use pharmacogenomic information, they can adjust medications in ways that lower the chance of adverse effects. This is not a replacement for medical guidance, but a tool that sharpens decisions. If you take multiple prescriptions, asking about pharmacogenomic testing with your clinician is increasingly recommended. For those navigating daily supplement routines, the difference between genetic insight and guesswork becomes obvious. If a panel shows that you cannot efficiently activate folic acid, then switching to the active folate rather than increasing doses prevents years of wasted effort. If it indicates you carry a variant that slows vitamin D metabolism, that knowledge explains why average supplement amounts leave you deficient. These are not exotic explanations. They are straightforward examples of how the fixed code you carry determines whether a standard, healthy regimen actually makes sense for you. Much of the frustration among older adults comes from relying on averages that never existed in real bodies. Doctors and public health guidelines are built on large studies that show what works for most people. Yet every individual sits somewhere along a range. A reduction in sodium might improve blood pressure for one senior, but trigger lightheadedness for another whose kidneys manage electrolytes differently. A common cholesterol-lowering drug might keep heart health steady in one patient while another experiences muscle pain or memory issues because their genetic profile makes the drug harder to tolerate. Without genomic information, it can take years of trial and error to uncover these differences, years marked by fatigue, discouragement, and sometimes hospital visits that could have been prevented. This is where the roadmap metaphor holds up. Having a stable genomic panel is like knowing the permanent layout of the streets you must travel every day. Epigenetic tests may reflect traffic conditions, the changes that shift with lifestyle and time, but the basic structure of the map doesn't alter. Seniors who see both can connect immediate experiences with lifelong wiring. You may discover that feeling drained had less to do with willpower or poor choices and more to do with pathways that were never efficient in the first place. That realization does more than save money on ineffective routines. It restores a sense of order to what might otherwise feel like random health struggles. The practical benefits ripple into areas beyond nutrition. When prescribing medications, physicians often start at a standard dose and adjust if patients report side effects. That process can be safe, but it is slow, and for older adults, it raises risks. A pharmacogenomic report can indicate from the very beginning whether a standard dose is likely to overwhelm your system or whether a medication that works for most people is unlikely to work for you. This can reduce dizziness, confusion, and dangerous interactions that often show up after age 65, when multiple drugs are combined. Despite this, many seniors never hear the option mentioned in their clinic visits. Some physicians are just beginning to incorporate these tools into practice, and others focus on treating symptoms with established guidelines. The result is that many people keep reporting fatigue, brain fog, or side effects while the actual explanation lies hidden in a report that was never ordered. This gap does not exist because the science isn't proven. It exists because medical systems take years to adopt new tools universally. In the meantime, patients who know to ask gain the advantage. There are also financial and practical considerations. Investing once in a genomic test can save years of supplement spending that never produces results. It can prevent the costs, both economic and personal, of side effects that lead to additional treatment or hospitalization. For a senior balancing fixed income and health priorities, even one avoided emergency stay shifts the trajectory of independence. These savings are not speculative. They are part of the reason numerous health organizations now recognize pharmacogenomics as clinically useful, though coverage varies by region. The psychological relief it brings should not be understated. Instead of wondering whether a lack of effort or bad luck explains ongoing fatigue, a senior can see written evidence that some pathways were less efficient from the start. That turns health management from guesswork into strategy. The cycle of trying every supplement or following rigid diets, hoping something finally works, gives way to a plan that aligns with your biology. This sense of clarity changes conversations with family, improves confidence during medical visits, and often frees energy for more meaningful activities. The actual process of testing is simple. A cheek swab or saliva sample is analyzed once, and the report maps out the stable parts of your biology, what your genome indicates about how you process nutrients and medications. If additional information is needed about current lifestyle impact or aging markers, an epigenetic test may complement it. But the foundation does not have to be repeated. Seniors often say the most striking feature is how quickly years of uncertainty condense into a clear explanation, sometimes in a single page of results. When viewed through this lens, the so-called mysteries of aging look different. What people blame on getting older is often the cumulative effect of mismatched strategies. Generic diet rules, blanket supplement advice, and trial and error prescription adjustments pile up until the body feels weighed down. Yet with a stable genomic roadmap, many of those mismatches can be identified early and the burden of unexplained symptoms reduced. The potential is not youth regained, but health optimized around what's truly possible for your biology. This brings us to an area where seniors notice the most immediate difference, the way medications affect them. Even small genetic differences in drug metabolism can mean the line between helpful and harmful. And when several prescriptions are combined, that line matters more than ever. It raises an important question. Why does one person tolerate a new medication easily while another struggles with dizziness or brain fog after just a few days? That question takes us directly into the next issue many seniors face, the hidden trap that emerges when prescriptions don't align with your DNA. The medication trap, when your DNA says no. Why does one senior start a blood pressure pill and feel faint within days, while another can take the exact same dose without issue? To many families, it looks random, and even doctors sometimes explain it as normal sensitivity or simply aging. But often, the explanation lies in what specialists call drug-gene interactions. Medications don't act in a vacuum. They are processed, transported, and cleared according to instructions written into your genome. For one person, the breakdown is rapid, leaving the dose ineffective. For another, the drug lingers, building to levels never intended. These differences matter most in older adults, who are prescribed more medications than any other age group. At the core of this process are liver enzymes, proteins responsible for breaking down most drugs you take. Every person has them, but small gene variations can change how well they function. If an enzyme is slower than average, the same dose might act like too much, leading to dizziness, confusion, or stronger side effects. If the enzyme clears medication too quickly, the drug may never reach a therapeutic level, leaving the underlying condition untreated. Doctors rarely see these differences without the context of testing, so reports of strange reactions are often misattributed to age or mood. This challenge intensifies with age. By the time many people reach their 60s and 70s, they're no longer on a single prescription. Instead, a typical medication list might include tablets for cholesterol, blood pressure, sleep, joint discomfort, or mood, plus over-the-counter supplements. Each additional substance interacts with the body's enzymes, multiplying the chances for mismatches. And it's not only genes at work. Older adults experience changes in kidney filtration, liver efficiency, and circulation. Combined with multiple prescriptions, these changes explain why older adults experience markedly higher rates of adverse drug reactions and hospitalizations compared with younger patients. Understanding how DNA contributes to these odds doesn't explain all risk, but it can highlight which people are most vulnerable. Blood thinners remain one of the clearest examples. These are life-saving drugs, but some genetic variants slow their clearance significantly. In such cases, a normal dose meant to prevent clots can tip into bleeding risks. On the other side, antidepressants are sometimes metabolized so quickly in certain individuals that they provide no noticeable benefit. When the drug doesn't work, the common solution is to increase the dose or try another class. Yet both steps can increase discomfort instead of relief. Cases like these aren't rare. They reveal how guidelines built around the average patient can overlook the range of real responses that seniors experience every day. The problem magnifies when medications overlap. Taking 3, 4, or 5 prescriptions at once means every genetic quirk is amplified by interactions between drugs themselves. It's easy to misinterpret the resulting exhaustion or confusion as disease progression. In reality, it can be a body overwhelmed by substances that aren't clearing at the rate expected. Genetics is one major contributor. Age-related changes in liver and kidney function and drug interactions also matter. This layered complexity is why seniors face higher risk compared with younger adults receiving the same medications. Genetic testing offers a way to shrink these blind spots. Pharmacogenomic reports, for example, reveal whether you carry faster or slower versions of key enzymes. Knowing this, a doctor can shift from guesswork to precision, lowering or raising doses, substituting different drugs in the same category, or in some cases avoiding a medication altogether. The goal isn't to make prescriptions risk-free. No test can guarantee that, but to tilt the odds away from hospitalization and towards stable daily life. Pharmacogenomic testing can sometimes help clinicians choose safer doses or alternative drugs. Ask your doctor whether this testing is relevant if you're taking multiple prescriptions. Consider how often families misread brain changes in older relatives. A father might seem sharp and lively, but after a new prescription, he grows forgetful, loses track of time, or naps constantly. These changes are often seen as dementia, but in some cases, they are the direct result of drug levels accumulating in the bloodstream because metabolism is too slow. Adjusting the dose based on genetic guidance can reveal that it wasn't an inevitable decline, it was chemistry that could be altered. The interaction between medications and nutrients adds another dimension. Stomach acid reducing drugs remain common in seniors, but also reduce vitamin B12 absorption.